I'd like to call the November services meeting to order. Can we have a motion to approve the agenda? Mr. Tanisha and Kurt, Ms. Kern seconds it. All in favor?
Aye.
Anyone opposed? Carried. A motion for the to approve the October 2020 minutes. Motion made by Rita Kern, seconded by Mr. Smithers. Any discussion? No discussion, all in favor? Opposed? Aye. Carried. On to COVID update with Dr. Dana McGuire and Dr. Andrew Williams. And who would like to go first?
I'll go first.
Dr. Williams?
No, I have the slides to show where we are with the status first. So I'll start by sharing my screen.
Okay, Doctor.
So as of today, we currently have 619 cases to date. That's since March 25th. We currently have 12 people in the hospital. There are 120 are active cases. So those are the people in isolation who have tested positive, and 403. Just on last Friday, we did receive word of our 6th death in the county. If you compare what we have this week to last week when we had this meeting, we had 500 cases. And compared to the previous one, we had 424 cases. So here's the graph that just shows all the cases we've had on a daily basis since the response started. And you can see that the curve is much more steep, and it just continues to rise, where in the spring we saw it kind of jump up and down more often, but we really haven't seen a case or a day of cases less than 8 in quite some time now. When you look at what we're seeing on a weekly basis, this has definitely been the highest case reporting week. We're currently at 110 cases this week with one more day to go. The last week we had 76 cases for the week, and that highest week we saw in the spring was at like 49 cases. And on an average daily case rate, we're seeing now just over 18 per day. That's an increase of 180% since last, and about 250% increase since the highest week we saw in April. Just to put this further into perspective, in the first 2 months of the response, from March 25th to May 25th, we just saw just under 200 cases. And for the first 2 weeks of this month, from the 1st to the 15th, we're now over 200. So 1/3 of the cases that we've seen for the overall response here in St. Lawrence County have just occurred in the last 2 weeks. So we are doing a lot with case investigation and tracing. So we have trained all of our staff, have approximately 5 departments in the county that are also helping us. We have the virtual team, so we can train more people to do contact tracing. We're still looking to get more case investigators. We also have been putting out quite a few of the potential exposure notices, and we do that when we're unsure of who might have been in a location where someone who has tested positive had been for quite some time, just to make sure that people can be aware and that they can get tested when it's needed. We have the ability to try to flatten the curve. And so while we will have an increase and we have more cases, we can work hard to try to decrease just the spread that we're going to by the same recommendations that we've talked about for a while. To make sure that you wear masks while in public, that you do continue to practice social distancing, use hand hygiene, and really stay home if you do not feel well. And while just across the state and the nation, we're seeing an increase of the cases, it's important that we stay local and think about the importance of when we need to go out because the exposures are just likely in most of the places that we've been going. At this time, that's what I have for an increase. So I will stop sharing my screen and allow Williams.
So good evening, everyone. So I wanted to just follow up on what Dana said by talking about national trends. And I'll just point out that in September, we were down to 35,000 new cases per day. This is nationally. And now we're up into 100,000 cases per day, which is a dramatic increase. If you look at deaths per day, we're also seeing a substantial increase. Now we're at around 1,200 deaths per day with some fluctuation. If you look at a summary of what's happened nationally, we have at least 11 million individuals who've been infected. We have more than 245,000 deaths. We have an average of 145,000 cases per day over the past week, which represents an 80% increase in the compared to 14 days ago. If you look at our regional trends, and again, that's the 7 counties that make up the North Country region. And just a reminder that the way New York State makes guidances about COVID, it tends to be on a regional basis. So it's important for us to understand how our region is doing. So back in April, when we were seeing what we thought were a lot of cases, we were at about 3 cases per 100,000 residents. We then decreased over the summer and early fall to 0.5 to 1. And now we're, as a region, at 12 cases per 100,000 residents. So a pretty sharp increase, which is similar to what we're seeing in the county. Just to review what's happening with the colleges, they continue to be doing a very comprehensive testing program and mitigation program. All 4 campuses will be finishing up right before the Thanksgiving break. They've done more than 40,000 tests during the entire time on the 4 campuses. As of yesterday, anyway, they had 30 positives, and they have 6 active cases. So they continue to take this very seriously, and I think do quite well. One of the big topics that as the county looks at all these additional cases has been what to do with the pre-K through 12 schools. And so I thought I would just briefly summarize some of the key findings and some of the research that's available. And I put up here that I actually looked at the World Health Organization and also the European CDC, partly because Europe has generally taken the approach of doing everything they can to keep their schools open. And so we have some more public health research that's coming out of other countries. So the first point is that in most cases in the pre-K through 12, when the cases are reported in children, the children actually acquired the infection at home, not at school. It does appear that children who are less than 10 years of age are not as susceptible and not as infectious as older children. In school outbreaks, it's more likely that the virus is introduced to the school environment by adult personnel at the school, not from a student. And student to student and student to school related adult transmission is actually quite rare. And this is international and national literature, but we're seeing the same kinds of trends around here. There's also a strong connection between school outbreaks and local disease prevalence. So if you have a community that's seeing a large amount of COVID cases in the community in general, you tend to see the same thing happen in the school. And kind of related to that, however, you don't see that schools being open increases the rate of infection in the community. Infection is already low. And then large outbreaks in schools, they do occur and they're well documented, but they're actually quite rare. And they're also not likely to occur in schools that have comprehensive mitigation programs, as is the case in our schools. The second to last point is that school closures do have a significant impact on the local economy and employers, as people, struggle for daycare options and things like that. And then finally, school closures negatively impact equity, educational quality, and also child health and development. And that's been very well demonstrated. So these are just 9 points that I think are important for us to think about as a community, as each school district sort of struggles with the decision of what they need to do with their schools. I did want to give an update on testing. This remains a very important topic. I think everyone in the community, both healthcare professionals and public health, as well as the general public, acknowledge that we need better access to testing throughout the community. So just this past weekend and going forward, St. Lawrence Health System is offering weekend testing. Right now it's at the Canton site and the Messina site. The process for getting an appointment is the same as it is during the weekdays, but it is available on the weekends. As we discussed last week, partly because of the computer malware, there are lots of changes that happened temporarily. We are back to making sure that we call certainly anyone who has a positive test, but we're really working to make sure that 100% of people who had a negative test also get called. In touching base with some people in the community, I realize this is not yet up to 100%, but that is absolutely our goal. And I hope by the end of the week, we're going to see that be the case. And then an exciting development, which I mentioned a few weeks ago, is that there is a same-day lab-based PCR instrument that's made by a company out of Ithaca called Rionix. And we're really working to get those instruments in the community, in the county, so that rather than be dependent on sending these tests off to LabCorp or to the Mayo Clinic or to Boston, we're going to have more control over the testing in the county, specifically for the higher sensitivity PCR test. And then finally, we did receive some rapid tests from New York State, and Dane is finalizing plans to distribute those tests to community partners who are doing testing. So again, we realize that testing is critical, and we're working to optimize the process of testing for the community. I did want to just give a quick update on what I would call the science of mitigation. So the CDC on November 10th did just publish a scientific brief, which included 20 scientific articles providing evidence of efficacy of cloth masks, both for what we call source control, so that blocking exhaled virus and protecting other people who are surrounding that individual. But now there's more evidence that even cloth masks can protect the person who's wearing the mask. So I'd invite people to take a look at that briefing from the CDC. It's very informative and shows the science behind this, which is amazing. I do want to mention another thing the CDC published recently. They looked at women who had COVID, and then they looked specifically at women who were pregnant with COVID. And they looked at 38,000 individual women who were pregnant and had COVID. They actually found that there were 51 deaths in this group. And then they determined that if you were pregnant and had COVID, you were 2.5 times more likely to end up in the intensive care unit. You were 3 times more likely to end up on mechanical ventilation. So that's what people consider life support. And death was approximately 2 times more likely, actually 1.7 times more likely. So the vast majority of people that COVID when they're pregnant actually have a fairly mild course. But what this study demonstrated is that there's certainly some increased risk of complications for pregnant women. And so this is concerning. I did want to just address, I think as we look at what strategies we should take as a community, I think we've talked before about, the idea that herd immunity might be the answer, and some comments that mitigation doesn't work. And people often will look at Sweden as an example. I do want to just review some of the more recent data for Sweden. So if you look at how they've done over the summer and the early fall, like many places, they actually had fairly minimal transmission. But then, much like the rest of Europe and the rest of the world, there's actually been very significant rapid rise just recently. If you compare them to other Scandinavian countries like Denmark, Finland, and Norway, what you see is that Sweden actually has 8 times the death rate. And these are probably pretty good comparison countries. There is a question that's been brought up about how Sweden reports its death data. And what you can see from the blue line and the red line, these are both the same date. But what happens is Sweden, unlike other Scandinavian and European countries, they wait until the death certificate is finalized, which is at least a 2-week delay. So when people look at the death data and say, oh, there's no deaths in Sweden, even though they're having an increasing rate of cases, it's just because the data hasn't caught up. So I think this is just important to be aware of. So another thing I wanted to mention is, I think in the community, there's this sort of sense for many people of, I'm young, I'm healthy, why should this make a difference to me? And I think a very well-researched instance in Maine is a good illustration. So what they found, and people may have read about this, there was a wedding, which would be a joyous event for everybody, with 55 people. There was only a single guest who was COVID positive. They were able to demonstrate that 176 other people ended up with a virus from that one individual. And as a result of that, 7 people ended up dying, and none of them had attended the wedding. So when we talk about community responsibility and the impact of our actions, I think this is a very good illustration of how what should have been a joyous occasion, done without masks or distancing, actually ended up in the death of 7 unrelated people, which I think is very concerning. Quick update on vaccine development. So there's exciting news about the vaccines. As I mentioned at our last meeting, the Pfizer vaccine is in its phase 3 of its trials. The interim report showed that it had a more than 90% efficacy. It's still awaiting the emergency use authorization from the FDA, and there are significant distribution challenges related to freezers. So it has to be at like minus 74 Celsius. Moderna, which is the one that's been done in cooperation with NIH, just released their data today, which shows approximately 95% efficacy. It's also waiting for the FDA emergency use authorization, but it can be stored at minus 20 degrees Celsius, which is the same temperature as the varicella vaccine and some other vaccines. And it can also last in lower temperature refrigeration for 30 days. So a lot of the challenges probably won't be present in terms of cold chain storage. I also want to just put out there a concept of, people are worried about shutdowns. And I should mention that the shutdowns are not going to come from the county. They tend to come from New York State. But I wanted to just mention a concept out there, which is called the circuit breaker approach, which, unlike a shutdown with an indefinite date, is a short period where there's significant restrictions, but there's a specific set end date. That end date needs to be within 2 weeks because of the transmission period of 14 days. It's considered a reset switch, And the idea is that there should be less economic damage and less psychological stress. This is something that's been implemented in Ireland, in England, in Israel, and France and Germany. And the idea is, if you look at the deaths from COVID, if there's no change, you see this rapid rate of increase. If the circuit breaker is thrown, then you go along this line and you see that there's a significant decrease in death. At some point, you still reopen. It's just a much shorter period of time for there to be restrictions. I would still argue that a better idea continues to be what Dana and I have talked about, which is the 5 pillars of prevention. What we see in the cases, if people follow these 5 pillars of prevention, it's much less likely people will get COVID, and we can avoid the more drastic measures of things like shutdowns or circuit breakers. So that's my update for tonight.
Any questions of Dr. Williams or Dr. Dwyer? Ms. Kern?
Kevin had his hand up first, but then I.
No, go ahead.
Oh, you sure?
Yeah, I'm still scratching there.
Thank you. So thank you for your report. I do remember seeing part of those articles about the masks, and I think that I told you the other day that we got Louisville, the town of Louisville, to buy some of those N95s for their people who have to be out and about everywhere to try to use. It kind of gives them some coverage, but I guess I'm kind of concerned. We've had this huge bump essentially in the last 2 weeks since election night. I don't know all of the who's, what's, where, and why, but it would seem that somebody hasn't been wearing their mask somewhere because we have all these extra cases. And there's been multiple reports about gatherings on election night, a couple in particular, and some people that they're concerned about that are positive, and some people who are on quarantine. And it would seem to me that part of what the public is looking for is just like that case study that you did from the wedding in Maine. People are looking for some rational explanation about why it is that when we have all these, I guess, all this stuff going on and all these suggestions about how to conduct ourselves, we're still having this big, I guess, report of all these gatherings and people who weren't wearing masks. And now we have a couple hundred patients and 9 or 10 people in the hospital and an extra death.
Mr. Arkwood?
Thank you, Mr. Chairman. Doctors, I think it was around mid to late summer when the numbers were declining, and we no longer reported during the weekend, and then we would get the weekend report on Monday. You know, and I certainly know how busy that increased numbers. I know how busy, much more busy that puts on your staff. But with the cases increasing, I think that would be a valuable thing if we could reinstitute the weekend reports if it wasn't too laborious on your existing staff. Is that possible?
I can take a look at that, but staffing on weekends with the increase, our focus really is on case investigation and contact. So let me see if we can do that, but at this time, I'm not quite sure.
Go ahead, Mr. Burke.
Given the large increase in the past week, I guess I'm wondering, trending, what do you project, and what is our state of readiness if these numbers continue to grow as they've grown?
I mean, I guess I'll take a shot at answering that. So I think the big concern that we all have right now is that we're heading into the holiday season in a position where we have more and more cases on a daily basis. One of the things that we see as a trend is that some people are getting the infection when they're out and about and not wearing masks, or maybe at a gathering without masks. But one real trend that we see is family transmission. So probably, and Dana can correct me, at least half of the cases are family transmission. So it's somebody who maybe went to a gathering without a mask by themselves, but then they come back to the family. And I think I mentioned that the CDC showed that about 75% of household members can expect to get the infection once one person has it. If you think about what many people usually do for Thanksgiving and for the winter holidays, it's all about family. It's all about family gathering. We live in a climate where it's very hard to have an outdoor Thanksgiving meal. I think some of us are trying to figure out how that would happen, but usually the weather's not doesn't allow for that. So I think there's a real concern that we're heading into holiday season at a fast clip of new cases. We have great vaccine development, but it's not available. So I think we're heading for some difficult times. Dean, I don't know if you had a different thought.
I agree with what you said.
Go ahead. Go ahead.
Our cases are due to the family linkages, to people being symptomatic and not realizing it, going to work. And usually we see it for just, kind of 5-6 days. And I would say that it's the smaller gathering that we have seen, and it started just before like the weekend for the Halloween. So since then, we've been seeing this rise. So with that happening, I do believe that's why the new executive orders did come out, really talking about that 10 maximum for a household type of a gathering, trying to look at the holidays and just trying to be cognizant of that. And so as far as being prepared from the public health point of view, we continue to have more staff, and we continue to have more assistance from the state team. With this increase, we are just trying to train enough people and to just get up to where we need. And, we're starting to get to a point where it does take 2 days to get to the case. We used to get to things right when we heard about it. But when you have, more than 20 cases in a day to look at, there's going to be.
Kevin Akers.
Thank you. Dr. Williams, from your presentation, could I infer that it's actually more important that the schools remain open from the statistics, the data that you presented tonight?
I think the conclusion I would draw from the data is that we all know that school is very important. It's very important because it's where we educate the next generation. I think the data would suggest that schools are one of the safer places for kids to be. But it also suggests that, these decisions about school closures, they're very difficult decisions, and one has to weigh all the various factors with an emphasis on the importance of school, both to the children and to the parents and to the economy, but keeping in mind that I think one of the things we found actually is that the staff for the school are becoming infected. And so there's issues with, people who are in charge of transportation or people like that. So I think what it means is it's just a very difficult decision that has to be made, by school districts. It's a little bit reassuring when I look at it, because I think my gut instinct had been that school closures really should happen and that really would help the epidemiology of it. I think there's a lot of evidence that schools are more a reflection of the community and that they don't drive infection in the community, and that it's a place where kids get to see modeling of what I would consider appropriate public health behavior. So the schools are taking this very seriously. And I think the 5 pillars are practiced in one place in this community, and that's in the schools. So that's what I would take from it. These are difficult decisions, but there's a lot in favor of continuing schools if that can be done. And I think if you think about, continuing to have bars open versus continuing to have schools open, I'll let other people decide what the priority should be, but I think schools are awfully important and generally very safe.
And these staff members are required, I think, actually probably Nicole could answer that, they're required to wear their mask around the clock. So that would be transportation, custodians, or whatnot. The other part that I think you're probably scared the hell out of pregnant moms, and And they're, with the data that you released, I divided 51 deaths by the 38,000, and I come up with 0.0013. So they may be more susceptible, but the fatality or the morbidity is really quite low. Would you say that? Could I conclude that from that math?
You can, and if I didn't emphasize it enough, I apologize. The vast majority of women of childbearing age who are pregnant, if they were to get COVID, have a mild illness or even an asymptomatic illness and do quite well. What's just important to understand is that if you take a pregnant 30-year-old woman and a non-pregnant 30-year-old woman, there is increased risk associated for the pregnant person. And so I guess it's just important for people to realize, because as we talk about this, I'm young, I'm healthy. If I get COVID, I'll just deal with it. There's women out there who are pregnant, and it's part of our responsibility as community members to help protect them, just like we look to protect the elderly or people with comorbid illnesses. So again, the vast majority of people who are pregnant who might get COVID do quite well, have healthy babies, but it is a risk factor for a worse outcome. And I think it's important for people to know that. And it was something that was just published and is from reliable data.
So the third point, and I just want to understand that I'm not advocating for what's been taking place in Sweden, but does not Sweden have a higher or a lower death rate per million than the United States? I think we're at, I think Sweden is 600 and some per million. And then I think with the United States, we're over 700 per million now. Would that be accurate?
I couldn't say the exact rate. What I would say is I think the better comparison is to its neighboring countries who have more similar demographics and so on and so forth. But I guess that's what I would say. And I guess I just use it as an example. I think people, and you and I have talked about this, people use Sweden to bolster their argument, whichever side it is. But I think if you look at what's happening now, and I think within the Swedish community, I actually was going to copy. They have something that looks very much like the 5 pillars of prevention. I'm sure it sounds different in Swedish, and I don't speak Swedish, but they've actually, restricted church services. They've asked people to stay home. They've now, in recognition of their very serious surge, all the language that's coming out of there seems very similar to what Dana and I have been saying. So I think it should be acknowledged.
Well, I think issues that I hear from my constituents is, well, the science is the science, but the science of the number of people that you're going to have in your house, 10 people, there is no science behind that. And I think probably per square footage or whatever, wherever you're having your home, whether you got 10 people in a kitchen and a 1-bedroom apartment would be different than a 4,000 square foot rambling country home or whatever. So I think that's what I hear from constituents. Their concerns is they're getting mixed messages about the science. I don't want to denigrate anything. I think that you and Dana have done a fantastic job of helping keep St. Lawrence County residents safe, and I appreciate both of your efforts and your teams.
Sure.
Legislator Haggard.
Thank you, Mr. Chairman. I have a comment rather than a question. Last week, I made some comments about concerns that I had and things I'd heard from constituents. And unfortunately, there are people that perceive that as critical and accusatory. That certainly wasn't my intention. But regardless of my intention, I would want to sincerely apologize if I offended any of the employees. I do believe that they are working as hard as they possibly can. And I have the utmost respect, particularly not to single you out, Dr. Williams, but I know there are a lot of people that have a lot going on in Dana's department. And I'm very grateful for all their dedication. I brought that to the meeting as a concern for my constituents and things that I have heard. And I appreciate you addressing those concerns during the meeting. Thank you.
Legislator Burke.
Question for Dana. Given the challenges, Dana, that you faced today, and the likely challenges you're going to be facing a week from now and 2 weeks from now, what is it that you need from the legislature?
Well, I wish I knew exactly where we were going and how steep we were going to go. So I think it's important we all try to make it so the curve is not as steep as it could be. We are working to get more case investigators. We do have a job description out. We're working on those things. We're trying to plan for more contact tracers. I don't know specifically what I need from the legislators. It's a combination of needing more staff, but the more staff you have, just more organization that goes into it and all the pieces that have to be brought together to keep us in a solid response. That we can answer that we receive from that's what we're working on.
Legislator Kern.
And Dana, I think we had kind of touched on this before, but I have a number of nursing people, medical people that would be willing to give you some volunteer time if you need that. I know how hard it is to do that. And you kind of have to have a background in some of this to sort of understand the public health piece. I think the biggest thing I see when I talk to people, even my patients, when they call me and say, hey, listen, I just got tagged by public health, they'll say, do I have to tell them everywhere I've been? Yes, you do. And I think a lot of your biggest problem you're having right now is that people are only telling you part of where they've been or part of who they've been with, and people are not even being honest that they're on quarantine. And that's a problem. People should know that, and people should tell you everywhere they've been. If I could say one thing to everybody who's listening is, if you have an exposure, please tell public health exactly who you've been in contact with. It makes their job a million times easier.
Legislator Fay.
Ask Dr. Williams. I had an email before I came to tonight's meeting, and they were saying that a public housing authority where contracted peoples went in for help were thrown out because they didn't have N95 mask on, but they were wearing masks. Should that be a requirement that they're wearing N95 masks?
Sorry, tell me, what was the context again?
Got a mask. That the housing authorities demanding the masks had to be N95s. Should that be a rule?
I'd actually defer to Dan on that. Generally, N95s, which are the highest level of protection, are reserved for certain circumstances when you're dealing with a COVID positive patient or in an especially high risk environment. So I guess I would need to understand more about the situation, but Dan, I don't know if you want to comment.
I would say this. We recommend face mask and 95 and for the emergency situation.
So you're saying that basically if someone is going in as a contract employee to help clean an apartment, they would not need an N95 mask?
Well, I think if it's an environmental concern, is it just COVID-19, or are you going to clean where you also have to worry about some other things so that you want to have a more environmental type mask? I think maybe we can talk offline to see what types of things the person might be kind of running into.
And thank you.
Yeah.
Dane Forsythe, are you
Yes,
putting it? Yeah, go ahead.
yes,
Dave.
please. Dana, the Amish community. I'm hearing that there's cases in the Amish community. Are they being tested? Are they cooperating with being tested?
So we do have a few cases in the community, like Ruth mentioned previously, or actually that was not at this meeting. So we did go out last Friday to talk to some of the bishops to kind of reiterate some of the education that we had done. We talked about testing. They are not regularly going for screening testing, or, they have had some of illness, in their communities. They're not regularly testing. They are getting tested if they're brought to the hospital. We are working with some of the rapid tests that we've been provided by the state. Dr. Williams does plan to do some testing, and you may want to speak about that, but we do try to educate them on a regular basis what the importance is. On the cases we have had there, we do talk about the importance of what the isolation process is, what the quarantine is, on mask wearing, on hand hygiene, and some of the gatherings that they have with church and how they should modify those things. And so we are working on that, but we continue to provide the education.
Also, the fact that they're still visiting stores, the boys are working out. How are people supposed to know they have the boys working on their farm or working on their house or doing whatever? How are people supposed to know that they're safe, I guess, would be my question.
So I'll just make a slight amendment to what Dana said. So actually in my community health center, we see quite a number of Amish patients, and we've actually tested quite a number of folks in the Amish community. So many of them are getting tested. It's not uncommon for people in the Amish community not to seek medical care for any reason. So
Sure.
I don't see their behaviors for health seeking too much different with COVID compared to regular illness. But we have tested quite a number of people in the Amish community, especially at the health centers. And I would say, frankly, I had a long conversation with one of them today. A lot of their concerns are about, how pandemic response and closures. It's the same conversation that I have with other people in the community. Yeah. I had a conversation about herd immunity with one of the Amish guys. So, it's the same kind of questions. It has less of a political bent to it, but it's thinking in the same way. So they do get tested.
You feel comfortable with the idea of it, though? You feel comfortable?
And
okay.
I would say in terms of people like working on a farm and things like that, it's the same thing as any farmhand or, anyone who's coming to do the milking. I think there's always a concern that somebody has it. I think we've been very clear with our folks in the Amish community who I'm in touch with that we expect mask wearing. I tell them about the 5 pillars, and and they understand that. We have a campaign with the buses to emphasize the fact that part of being a good community member is to wear a mask to protect others, and I'd say that's largely been well received.
Okay, thank you.
Any more discussion, questions? Guess there is none. Thank you, Dr. Williams, Dr. McGuire, for your ongoing fielding questions here. Very informative. Thank you.
Welcome.
Moving on to resolutions. We have a resolution authorizing the chair to sign contract with Vanesky Company for Article 6 state aid processing for the Public Health Department. Do I have a motion? Mr. Kern makes a motion. Who seconds it? Mr. Smithers seconds it. Okay, go ahead, Dana.
So this is an annual contract that we use for the processing of the state aid within our department. There really are no kind of changes to this resolution or the fees that are associated.
Any discussion or any questions, Dr. McGuire? Being none, all in favor?
Aye.
Opposed? Carried. Next resolution is authorizing the chair to sign a contract with Dr. Benjamin Gruda for pharmacist services for the Public Health Department. Is there a motion, Mr. Kern, seconded by Mr. Lightfoot? Go ahead, Dana.
Okay, so this is also an annual contract for the pharmacist we have who does the review of the clinics. So this comes around just on an annual basis.
Any questions or discussion? Being none, all in favor?
Aye.
Opposed? Carried. We have another resolution authorizing the chair to sign a contract with James McGinnis and Associates Incorporated to provide billing processing software for the preschool program for the Public Health Department. We need a motion. Mr. Kern, Mr. Smithers seconds it. Go ahead, Dana.
Okay, this resolution is to provide an annual contract for the billing processes we use for the pre-K program. So the fees associated with this processing are staying the same.
Any discussion? All in favor?
Aye.
Opposed? Carried. Another resolution from Dana authorizing the chair to sign contracts for early intervention services for the Public Health Department and setting 2021 rates for early intervention services. Need a motion? Someone on the screen. Looks like Dave Forsythe. Seconds by Rick Perkins. And go ahead, Dana.
Okay, so this is for the annual contracts for the EI services that we have throughout the department, and this sets the rates for the providers that we have.
Mr. Akers, go ahead with your question.
Dana, there used to be is that an hourly rate, daily rate, or a half-hour rate? I mean, they used to come in as half-hour rates. Is that what these are?
I believe they're a 50-minute rate for EI. I'll have to check. It's either 30 minutes or it's a 50-minute rate, and that varies when it's the EI program versus pre-K. I can check on that for you.
Okay, thank you.
Any further discussion? Being none, all in favor?
Aye.
Opposed? Carried. Next resolution has to do with the Office of Aging, authorizing the chair to sign the 2021 Annual Update Plan, AU, for funding with the New York State Office for the Aging. Do we have a motion?
Motion.
We have Larry Denisha makes the motion, seconded by Mr. Akers. And go ahead, Andrea.
Okay, good evening. This is our annual resolution for our plan for funding that we do with the New York State Office for the Aging, and this just authorizes the chair to sign that plan for funding.
Okay, any questions, Andrea? Any discussion? Dan, Faye? Put your hand up? Okay. All in favor?
Aye.
Opposed? Carried.
Thank you.
You're very welcome. Thank you, Andrea. Next resolution is authorizing the chair to sign contracts for community services. Is there a motion? Motion by Rick Perkins, seconded by Mr. Akers. Go ahead, Jay.
Thank you and good evening. This first resolution is an annual resolution for authorizing the chair to sign the contracts with the downstream providers. These figures are really our best estimate based on the 2020 state aid funding letter. We will not get the 2021 funding letter until somewhere between the first week and third week in January. So we're passing this resolution through kind of as a placeholder so that we can continue to distribute the state aid funds to these providers in the county. And it may be likely that we're going to have to come back sometime in February or March and amend these figures, depending on the state aid letters.
Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. Another resolution authorizing the chair to sign an extension of the contractual agreement with locum tenens staffing agencies. And Mr. Burton makes the motion, seconded by Ms. Kern. Okay, go ahead, Jay.
We currently use locum tenens on the chemical dependency side for MAT services, that mostly being Suboxone for opioid use disorder. We have a contract allowing the locums provider to work 2 days a week. That contract runs out in December the 9th. For the 2021 budget, we had moved the contractual funds to personnel funds in hopes of hiring a part-time prescriber to replace the locums tenens. We've been advertising for that position. I believe we have one application to date. So this is a 6-month contract in the event that we cannot locate and or employ a prescriber for the chemical dependency clinic. This is kind of a backup plan if we are unable to hire someone part-time.
Any discussion? All in favor?
Aye.
Opposed? Carried. Resolution authorizing the chair to sign an amended contract for one-time grant funding from the New York State Opioid Response SOR and modifying the 2021 budget for community services. Need a motion by Mr. Lightfoot, seconded by Mr. Akers. And go ahead, Jay.
All right. Community Services received $225,000 in a competitive award through SOAR for a mobile treatment vehicle. There's going to be multiple uses for this. We will be able to use it both on the mental health side and on the chemical dependency side to hold individual counseling sessions. The vehicle will also be equipped with virtual technology. So when out in the community, if they see their counselor, they will also be able to zoom in and see their prescriber if they are being prescribed medicated assisted treatment medications. We will also be using this for monthly injections and drug testings. And additionally, we'll also probably have recovery peer advocates accompany the counselors when they're out in the community, as well as family support navigators aimed at increasing engagement and connectivity to community-based services.
Go ahead, Mr. Burke.
Jay, this will be used primarily as an adjunct to our services, county services.
Correct.
Yeah.
I mean, we're going to have to be, very strategic on its use. It's going to approximately be 24 or 26 feet, depending on how the bids come in, the RFP. But it will have 2 rooms. One will be more of a medical room, and the other would be more of a counseling area. So we would, line up, appointments in a certain geographical area in the county and drive to that place with preset appointments in hopes that we connect with people in the community. If they don't show, we still have, telecommunications so that the counselors could, even, do a counseling center if in fact someone no-shows for their appointment. So we're going to try to make the best use of it. Bang for our buck.
This is a great addition to the services that we provide, especially in a county as large as ours, Jay, and you and your staff deserve a lot of credit. Thank you.
Mr. Akers, go ahead.
Jay, I don't recall you talking about this at the Community Services Board meeting. Did I miss that or something?
We've talked about it months ago. We haven't said anything about it recently, just that we were, that we received the award.
So I know that basically, I think St. Joseph's have actually, they brought up a van and we walked around it and got in it and stuff. And I knew that St. Joseph's was interested in it. I did not know that the county was proposing doing the service.
Well, I mean, we applied for, like I said, it was a competitive award. We applied. One of the things that, one thought behind it was, if we make the satellite clinics virtual clinics instead of brick and mortar clinics, that, we will be able to continue to perform these ancillary services, those being the injections and the toxicology tests and the health screenings without necessarily needing a physical site. We could drive to the community, whether it be Governor or Messina, to perform those tasks in the events that we do go virtual.
So that would be part of the plan then, to actually eliminate the satellite sites and use this in its place? Would we be able to use the existing staff?
Yes, we're not planning on hiring any additional staff at this point. In terms of the virtual clinics, I mean, that would be a decision. It's been suggested several months ago whether or not that's the favor of the board, the direction that they want to go. That's still yet to be determined.
That would be the Community Services Board or the Legislative Board, Jay?
Well, I think it would be something that would be discussed at the Community Services Board, but in terms of county clinics, that would be a legislative decision.
Okay. One final question would be, would the operator of that vehicle require to have a Class B license?
Not to my knowledge, no. We've asked that. No, it's not going to be that large, and I'm not sure what the unburdened weight exactly is. I don't have that in front of me, but it's not going to require a CEO.
Okay, thank you, Jay.
Ms. Curran?
Hi, just a couple questions. So this was a grant that was separate, earmarked by the people who were giving it out specifically for a mobile access site?
Yes,
Or
this
was-
is. I'm sorry.
No, go ahead.
That's what the grants.
Yeah, this was part of SOAR dollars, which trickled down from the Fed into New York State. So, and it was specific for a mobile treatment vehicle.
Okay.
The other competitive award that we received from SOAR was $15,000 for technology for remote services, telepractice.
So we're going to be able to run this with the staff that we already have?
Yes, that's the plan, yes.
I think that's a wonderful way to be able to get into some of these, more remote communities without having to have bricks and mortar. I think that's a good idea. It'll give people better access. Thank you.
Any further questions? All in favor?
Aye.
Opposed? Carried. Another resolution authorizing the chair to sign contracts with sub-recipients for a comprehensive opioid stimulant and substance abuse site-based COSSAP program funds through community services. We have a motion. Larry Denisha, Joe Lightfoot seconds. Go ahead, Jay.
So last month, a resolution was passed authorizing the chair to accept the comprehensive opioid stimulant and substance abuse site-based program, or COSSAP grant, of $900,000. So this subsequent resolution is to authorize the chair to sign contracts with the three agencies that are going to be charged with implementing the grant, that being St. Lawrence Health Systems, Seaway Valley Prevention Council, and New Hope Transformation House Ministries, doing business as Grace House.
Any discussion, questions, Jay? Yes, go ahead, Mr. Burke.
I won't be supporting this resolution. $900,000 of taxpayer money, and the public has been deprived of the public discussion that should have occurred on it. The the strengths and weaknesses of the different proposals. And the meetings that were held were not meetings in compliance with the open meeting law. Again, the public was deprived of the discussion. And if anybody on the board should happen to know what those discussions entailed, I'd certainly be interested in hearing it, because I'd like to think that the $900,000 is being spent to the greatest efficacy for the taxpayers of St. Lawrence County.
Mr. Akers?
I will be supporting it. As I mentioned, and I've mentioned several times, that the Community Services Board has voted on this 3 times, and all 3 times they supported this. Part of this grant is actually using these entities: Seaway Valley Prevention Council, New Hope Transformation House Ministries, and in doing business as the Grace House. So we can keep fighting this, and what we're actually doing is actually delaying and denying treatment to those that suffer from addiction. Rita Curran has pointed out, legislator Rita Curran has pointed out, we've had 4 deaths, 3 on the reservation, 1 in Messina, and since that time, another 2 people have actually died, not just overdose, they've actually died. So I think it's time that we recognize that any further delays will result in additional deaths. We need to get this on the ground to get people some help. So I will be supporting it.
Any further discussion? Go ahead, Mr. Burke.
Well, I guess we can slant it however we would like to slant it. The reality is $900,000 of taxpayer money was spent, and the public was deprived of the discussion that awarded that to St. Lawrence Health System and to the other entities. The vast majority, of course, to the St. Lawrence Health System. I wholeheartedly agree that this should have been up and running by now. Interesting, and since the time element has been brought into question, I guess I would ask anybody there if you know what the timeline looks like for implementation. Once again, we don't know, because we weren't privy to the discussions. The public wasn't privy to the discussions. Another deal that's to spend taxpayer money without knowing what went into the discussions. It's wrong. The people that voted for it, knowing that open meeting law was violated, are wrong. And therefore, I mean, you can plead whatever cause you want, saying that it needs to be up and running. I agree with that. But there is no guarantee that that's going to happen quick anyways. But it needs to happen legally and appropriately, and the public have a right to that discussion, and they were deprived of that.
Mr. Akers, go ahead.
So the full story is the Community Services Board looked at who could provide the service and the enveloping services around that, not just the actual mechanical function of actually providing the methadone to the users. And when we're talking about taxpayer dollars, the public should be aware that community services cost us $1.5 million last year, and the projected budget for this year is a loss of $1.4 million. They also need to know that we wrote off $900,000 in uncollectible bills from up to the year 2017. It's projected that we're going to be writing off $275,000 this year for bills that run collected. My constituents support the hospital in actually providing this service at no taxpayer expense and at no risk to the taxpayers. And also in providing the best services for encompassing either the mental, the physical, the family, the housing needs, detox, all the other services that St. Lawrence Health Systems provides. They are one of our largest employers here in St. Lawrence County. They are a nonprofit. They do a good job. We need to support them. They can do this the best.
Go ahead, Mr. Burke.
Well, once again, Dr. Akers knows what's best. And I guess what I would say is if that discussion was held and the merits and the weaknesses and the strengths of the different proposals were evaluated, then perhaps it would be St. Lawrence Health System. My point is that the public was deprived of it. It was an open violation of the open meeting law. It was an illegal meeting. And here's the other thing. You talk about community services. The write-off that you're talking about, Kevin, are write-offs that nearly every medical provider has to write off, because when they bill for Medicaid, when they bill for Medicare, or any of the multitude of insurance providers, they put a dollar amount down, and depending on what that entity, that insurance provider or governmental entity will pay, is what they get. The difference is what's written off. It's not, it wasn't because of mismanagement. This is a practice that happens with every medical provider that's out there. They bill a certain dollar amount, assuming that the insurance will adjust it to whatever they're willing to pay. That's the nature of it. So it's not an indictment of public service. It's the way the system works.
Ms. Kern.
So I know last year, probably about this time last year, when I ran into the people from St. Lawrence Health System when they were first looking at the site that they'd like to put this opioid treatment center at, they were kind of headed ahead, not realizing that they needed to go through this whole process of getting community services to allow them to have it. I know that they may have even been up by now, but they're going through the process. I'm sure they're giving Jay updates, or if he wants one, they would give him one. I'm sure, John, if you wanted to know where they were, they'd be more than happy to talk to you. The problem I have with talking about the business end of this is that there's, I've seen this huge surge in the last couple of months. I've seen 6 families, and you know the families when they're from your area. I've seen 6 families bury their family members. And to listen to how they talk about it is really heartbreaking. I sit and talk to my patients as I'm trying to get them on something to keep them off the streets. Some of them come in because they want Suboxone that they know is Suboxone, because there's been so many people that have died from overdoses in their peer group. I just don't think it's about the business at this point. I think that the sooner we get something else up, because we're having cocaine that's laced with fentanyl, and a lot of people who are being given heroin that's laced with fentanyl. And Suboxone is helpful, but some of them have been addicted so long that they truly are kind of passive. And I'd like to offer them something. And I'd like us to think about that and what we really need to give to the community versus the process. The process, I think, can be fought behind the scenes, because I'm sure that any of the 6 families that just buried their family members don't want to hear about the process.
Mr. Arkwood, go ahead.
Thank you, Bill. We're all tasked with knowing and understanding the issues before us, and hopefully we all do our research. But on occasion, there'll be an area, for example, if there's an issue that involved the state troopers, we have the good fortune of having Mr. Lightfoot aboard that I would go to understand the issue. If it was industrial health and safety, we have Mr. Denisha sitting right there that worked for years in the field. If there's any of my colleagues that are unsure of how to move forward with this issue, we have an expert before us, and Mr. Burke, that worked in this field for an entire career. And I really ask that if you're undecided at this point on this issue, that you hear what Mr. Burke is saying. He's not saying it with malice. He's not saying it with any ill intent. He's providing expertise in an area of very strong concern. So I just ask that you consider that before you vote.
Any other questions? Go ahead, Ms. Sager.
Thank you, Mr. Sheriff. I have two comments I want to make. First of all, I remember Community Services saying that the building they were going to use in downtown Messina would take a week to retrofit. I think that's great turnaround time. And that would be up and running quickly for the people that we're talking about and that we all care about. Secondly, I'd like to ask for a roll call on this resolution, please, Mr. Chair. Thank you.
Any more discussion? I would just like to say that I'm going to support the resolution. As I pointed out in the Services Committee, or the board meeting, the last time we discussed this. We had one full meeting here one night when we listened to all the presentations from St. Joseph's, from the county to St. Lawrence Health Agency. And we all heard their timeframes. We all heard their spin on why they would be the best provider for us to do this opioid treatment program. And I came away that night feeling that St. Lawrence Health Agency would be the ones to go with. And then, as Kevin Akers points out, that the committee that makes a decision has been met not once, not twice, but 3 times, and they've all indicated each time they ended their meeting that that's what they wanted to go with, which is what this resolution calls for. So I'm going to support it. It's the Channel 7 News, I think, has covered it. Belt Watertown Times covered that meeting. The North Country Now covered that meeting. I think there's a lot of people read all about the presentations that were made that night, and the presentations were all very well done. So I feel that the public has had some input in terms of what they've read. And, so with that, let's have a roll call vote.
Is Ms. Kelly with us?
Kelly, you there?
Yes, I am. Reagan,
Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins.
Oh.
Akers,
Yes.
Fay,
No.
Haggard,
No.
Biacco,
No.
Burke,
No.
Arquette,
No.
Terminelli,
No.
Curran,
Yes.
eight yes, 7 no.
Motion carries 8-7.
Mr. Chair, if I may, I have one small interjection.
Who is it?
This is Jay.
Jay?
Yes.
Yeah, go ahead, Jay.
So you all received in your Google Drive the community services update. So I just want to say quickly that there wasn't any significant changes. The numbers remained pretty flat from last month. I don't know if anyone has any questions, on October's numbers, but yeah, there's no significant changes in terms of introduction.
Does everyone have the chart? Any questions? Jay? Thank you, Jay. It doesn't look like there's any questions, but I'm not able to see the screen now. Maybe there's some questions there from the screen when the chart moves off. Any questions? I don't see anyone's hand up. Thank you, Jay.
All right, thank you.
We have another resolution from the youth authorizing the chair to sign the 2020 resource allocation plan signature page. Do we have a motion? Ms. Kern makes a motion. Second by Ms. Terminelli. And Ms. Go ahead, Alexa?
Yeah, good evening. The Office of Children and Family Services requires that we submit a resource allocation plan signature page that certifies the approval of our programs and grant contracts for the 2020 Youth Development Program year. And then it also qualifies St. Lawrence County to receive state reimbursement for the program year.
Okay, any questions or discussion? Alexa? Being none, all in favor?
Aye.
Opposed? Carried. We have another resolution approving the 2020 Resource Allocation Plan RAP program of the Office of Children and Family Services and authorizing the chair to sign contracts for youth development programs. Do we have a motion? Mr. Lightfoot makes a motion, Ms. Kern seconds. Go ahead, Alexa.
Yeah, so this is our annual request as well for the contracts with the Office of Children and Family Services. This would provide funds for our youth development grant programs.
Any questions of Alexa on this resolution?
Yes.
Yes, Mr. Akers.
Alexa, I'm seeing that my local town, actually, and in Waddington also are not part of this. There's an application process, they are not interested, or what's the deal here?
That is correct. There was an application process, and what I have been hearing so far is that some of the counties and towns, just chose to pass on this. But yes, we do make this available to everybody. Coming in this year, though, I do want to establish contacts with everybody so as to get a little bit more interest in the future.
Is the application a difficult application, or is it that the towns can't provide have the person power to do the programs?
I haven't received feedback that it's, it doesn't seem to be concerns about people not available to provide the programs. I feel that the paperwork is pretty reasonable to do. Some of the feedback has just been, the amount of paperwork just, for some of the programs, not worth the $500 to $1,000 that they feel like they would have, been requesting. But this is kind of hearsay, what I've been told. My goal moving forward is to reach out and reconnect with, villages and towns and, get that dialogue going again as well. I would like to see, twice the list.
I will reach out to those slackers in Madrid.
Okay. Sounds good.
Go ahead, Mr. Denisha.
Thank you, Mr. Chairman. Yes, Alexa, I would like to say that, in regards to Mr. Akers' question, I was supervisor for town in Cal for a number of years, And we always took advantage of it because it was a nice stipend to our youth recreation program that was funded by the town taxpayers. As far as the paperwork that's involved, it's minimal. There's a report that has to be done at the end of the year. It takes maybe 20 minutes. So, you know, and I'm surprised that DeKalb was not on here as well. But yeah, it's not a hard thing, and it provides a good boost if you've got a youth recreation program.
I appreciate that feedback. Thank you. Yes, I really would like to spend this year in getting to know other villages and towns and look at opportunities.
Thank you. Legislator Forsythe.
It's muted.
Go ahead, Dave. Can't hear you.
You're muted.
Sorry about that. It seems like the Messina Boys and Girls Club was on this in prior times, and I don't see them on here. And I'm not familiar with Al of Messina.
That is Messina Boys and Girls Club. So the Messina Boys and Girls Club is now PAL of Messina. That stands for the Police Activity League.
Okay,
there was
that
a
answers my
change in
question.
name this past year. Yep.
Perfect. Thank you very much. Yep.
You're welcome.
Any more questions?
Nicole,
go ahead, Nicole.
Thank you. I'll be recusing myself from this vote due to an affiliation with one of the organizations.
Noted. Any more discussion? All in favor?
Aye.
Opposed? Carried.
Thank you.
Next, we have a resolution authorizing the chair to sign a contract for support cases between the Department of Social Services and the Office of the County Attorney. Need motion by Mr. Lightfoot, seconded by Dave Forsythe. And go ahead, Cindy.
Good evening, everybody. So in consideration of this contract between Social Service and the County Attorney, came about with we have approximately 2,400 support cases being seen per year. That's an approximate. So this would be considered a full-time job, and it does take one of our attorneys full-time to oversee this support. So in the development of this contract, there are some considerations that will be put in place. The contract will be reviewed after 6 months of its start. And with that, both the county attorney and the general counsel will have, a chance to review the data. I guess some of my concerns is I want to make sure that we are budget conscious when it comes to the cost of what it's going to be for us to contract out for these services, because it would be all encompass of the support unit. I do want to make sure that all the deadlines for court are met, because as the Commissioner for Social Services, I'm ultimately responsible and accountable, not only for the department, but to the state. I also want to make sure that we are, being responsible in what our cost is towards the budget. So, like I said, with the 2,400 cases a year, that's pretty huge on the department right now with the push of the court systems trying to catch up. So that's where this consideration came to contract with the county attorney for support.
Mr. Lightfoot.
Thank you very much, Ms. Ackerman. I appreciate your explanation of this. And I would like to say that even though it's not mentioned on here, but I think that you certainly have a need to weigh in on this at that 6-month period of time, evaluating it separately and distinctly from Mr. Haggart and Mr. Button. So I would want you to make sure that you had that on your calendar.
Any more discussion?
John has his hand up.
Who does?
John Burke has his hand up. Recording.
Go ahead, John.
Well, I guess I have a lot of questions and a lot of concerns about this. I'm wondering, it's a full-time job, Cindy. So, you know, if we were, what would the costs be ballpark for DSS hiring an attorney?
I would consider this type of position to be an entry level attorney, which would be about the $17,000. Have one right here actually from before. About $17,987 would be the cost of the county for that attorney.
And do we know, Cindy, what a contract would cost?
I do not know. I do know that I have looked at some contracts. I actually looked at the one from Jefferson County. They actually contract, you know, for their JD juvenile delinquents and PINS programs as well. So their costs are a little bit higher, but they're looking at, they also go by an hourly rate of about $52 to $53 an hour. So all I would do is probably look at, if we have approximately 2,400 cases a year, you know, it probably takes about, you know, an hour, half an hour to an hour or more per case. So that could be quite significant. That was one of my only concerns, is that, you know, I wanted to make sure that this, you know, in development of this contract, that we were looking at the overall cost, just to make sure that it is not going to, you know, actually exceed the cost of an attorney.
Well, I have another question, Cindy. If you don't mind, Mr. Chair, I have two or three. Yeah.
Go ahead.
The ultimate responsibility for support collection is yours. Is that right, Cindy?
Correct.
Yeah. So that, and I guess I wonder, how does that work if you contracted? You know, if a portion of that were to be done, or a significant portion were to continue to be done by the county attorney's office, I mean, how do we deal with issues as to who do they answer to? You know, the responsibility to assure the job gets done is obviously yours. The county attorney has a responsibility to the board and to the county at large. And I guess I'm wondering, and, you know, how do we reconcile that dual allegiance or the potential conflict? I'm assuming that whatever you contract for with whomever, if you decide to contract, you're going to hold them accountable to produce the results you want them to produce. And I guess I'm wondering, how would we even pursue this without creating potential conflicts of interest? And again, and I guess I'm wondering, is it fair to you to ask you to contract out a core portion of the area that you're responsible for, when you could easily, I shouldn't say easily, when you could potentially recruit a person to do the job and have full control of that effort? Why would we contract out? And again, I don't mean to put you on a spot, Cindy, but I guess I'm trying to understand. And the other part of this is, and I guess this would go to the county attorney, you know, do we have an excess of time in the county attorney's office? Is there 30 to 40% available time there? And if so, should that not be a concern? Oh, Cindy, maybe the first part. maybe, sorry about that.
I think I do agree with you, and I think that when we had to, you know, discuss to the appeals attorney, I think when it comes to contracting out, you know, one of the concerns are that when there is a contract, there is a portion of that is out of your control. You know, if, I'm not saying our county attorney is going to be behind or anything, but, when you do contract out, that does become a concern. So it would definitely have to be, we haven't developed the contract yet. So I think in the development of the contract, there would, definitely have to be, certain, stipulations in there, to keep all that stuff, upheld. The other thing too is in talking to some of the other district attorneys, other commissioners, I know that the state has had some issues with some of the contracts because they're, with all this change in funding, not a lot of change in funding, but they're going to be looking more at quality versus quantity. They're putting different stipulations in on services, that they are looking at contracts more, I guess, reviewing them more intensely, just to make sure that their money is going to the programs.
And again, I guess, Cindy, I'd ask the question as why would we go down this path if we don't have to?
Well, good question.
Mr. Akers?
I'd like to recognize the county attorney. Maybe he can speak to this matter.
Okay.
Good evening, everyone. I appreciate being recognized on the issue. To answer some of Mr. Burke's questions, I'm not sure if you're aware, but currently my office already handles all of the Uniform Interstate Family Support Act cases. Those are all the child support cases that are transferred to St. Lawrence County from outside of St. Lawrence County. So if an order is issued in Nebraska or Texas or California, and someone looks to have it enforced here in St. Lawrence County, it's my office that actually is here. My office also is currently responsible for all of the JDs and PINs that currently occur within St. Lawrence County. Now, there are certain PINs that are handled at the school district level, and the school will actually send in their attorney to handle it. But those items that arise where, if perpetrated by an adult, would constitute a crime, they're prosecuted by my office, actually handled as a part of everything from the raise the age issues to juveniles of the age of 12 or 11, if they had committed an offense, would have been a crime had they been an adult. I know the board is aware that my office was already heavily active with DSS Legal back at the beginning of the year. In fact, at that time, due to staffing issues, my office stepped in and was there from January 28th until April 5th, when there were only 2 attorneys in the DSS Legal office, and myself stepped in to actually handle a lot of the function. What I don't think this board is really aware of is that outside of St. Lawrence County, it's actually quite normal to find that the county attorney provides oversight associated with the DSS legal operations. While you will have dedicated county attorney staff to handle DSS operations in the form of Article 10s, which are the neglect and abuse cases, or Article 4s, which is the child support, it is still typically handled by someone that is affiliated with the county attorney's office. It is not an abnormal scenario. And in fact, in the absence of having DSS Social Services Law Section 66 attorney designated, that function actually devolves to the county attorney to handle. So if we didn't have a DSS legal office over there, my office would be legally responsible to handle that function. My office handles all of the defense of DSS and the department head associated with any casualty and liability claims. As this board knows, there are currently quite a few lawsuits that I deal with across the county, and several of those do involve DSS. So with respect to Mr. Brooks' question, whether or not this could produce conflicts of interest between my obligations to Ms. Ackerman and my obligations to DSS as a unit, my obligations to the county as a whole, I'm currently engaged in support matters as well as in casualty and liability claims, as well as in JDs and PINs on behalf of the department and on behalf of the county on a regular basis. In fact, we had 2 appearances today, 2 appearances tomorrow. Now, with respect to being able to handle the additional load, my office, I think, can handle this without the requirement of assuming additional staff. The reason being is that, as I've already indicated, we're already in those courts. What I do believe that I would require would be clerical staff that is currently performing that function to be available to actually provide that function for my office. So I'm not asking for the creation of a position. I would be asking for the dedication of that staff that is already performing it to be able to assist my office. But in terms of the attorney responsibility, you're right, Mr. Burke, it would be additional work, probably in the same vein as back from January 28th until April 5th, when I was working until 8, 9, 10 o'clock every night and working on weekends to try to get it done. But I think you all know me. You've all dealt with me, I think, for a long enough period of time that you know that if I get a phone call at 11 o'clock at night, I take it. If I get a text message at 5 o'clock in the morning, I respond. And that's just how it goes with this job. I do appreciate that it would be reviewed at the end of 6 months. I honestly don't know if this is the direction the board wants to go or Ms. Ackerman wants to go, and I don't know that this is necessarily the direction that will be needed for the department. But if this is an effort to try to assist DSS Legal to get to a position where they can be successful moving forward, I'm all for trying every effort that we can engage in to make sure that we can get them to the footing that they need to be on to be as successful as they need to be.
Have we, Steve, if I could, have we determined that need is currently there? I keep going back to the same question. Why would we do this if the situation could be solved within DSS under Cindy's jurisdiction and avoid going into your area, and certainly, Steve, it's true you have to represent the entire county and all of its departments in liability cases, but this is a specific function, and this specific function is a DSS function, and that's in support. And it's true that some of the smaller counties have the county attorney assume that role, but again, you know, we hold Cindy accountable for all the activities in the Department of Social Services, and I guess I wonder if that's the case, why would we try to fracture the effort? Why would we not give her the resources that she needs to complete the job? I have to say, you know, she's only been here a short period of time, but what I've seen, I think she's more than capable of doing the job. I think we're extremely fortunate in having her. So I guess go back to the question, why would we go down this road? We don't, it's almost like public health. I mean, would we give out the vaccinations or any of the roles, any of the core functions of public health? Would we look to contract that out? We only do the essential parts that we've done for years, but again, this is a core function of DSS, and I guess I wonder, why would we go down this road? Why would we even risk creating a conflict of interest by having two departments intermingled when it's not necessary?
Mr. Burke, if that question is posed to me, I think I can answer it several times over. First, as I know that the board is aware, DSS activities as well as employees are subject to a reimbursement associated with their activities. So those activities that are performed in the furtherance of DSS objectives and goals become potentially eligible for state funding reimbursement, so as not necessarily to pull from the county coffers. So if my office performed some of those functions where we weren't otherwise eligible for reimbursement for DSS, we now theoretically become eligible for reimbursement. The second issue, I think, is a policy question that ultimately you all have to decide. One of the things that I believe that I've indicated is that I believe my office can handle the responsibility associated with the support without the creation of a new position within my office. So theoretically, you're doing it with staff that are already on hand with the county. The proposal, as I think I've heard from you, Mr. Burke, is that the alternative would be, should we create an additional position in DSS Legal and just keep it with DSS Legal? That's largely a policy question that I think this board really has to resolve on its own, whether it wishes to create a position or have it handled internally. But I think those are the reasons that I would identify. Now, with respect to identifying a conflict of interest, I'm not sure that we're using that term in the same way. Conflict of interest under the model rules of professional responsibility associated with an attorney has a very specific connotation. I'm obligated to represent Ms. Ackerman under County Law Section 501. So providing this representation would actually be consistent with Social Service Law 66, which is consistent with my legal obligation. So from a conflict standpoint, I'm not sure from a legal conflict standpoint that exists. As to whether or not you're referring to a conflict with respect to time allotment, yeah, it's going to need time. It definitely will. It will put a strain on my office, but I work with some spectacular people, and you will never hear somebody more proud of the people they work with. And I know that my crew and my team pull together, and we'll do it for the best interest of the county if that's what the board decides.
Is there a salary adjustment to this, Steve?
Mr. Burke, I've had you ask so darn many questions, and there's other people that want to get some questions in. I'm going to go to Mr. Lightfoot now.
Thank you, Mr. Chairman. I'd like to answer Mr. Burke's question about how this all came to pass. If you recall, back 2 or 3, 4 months ago, Mr. Haggard sent an email out stating that Mr. Button and the county attorney's office would be taking over the support function for the Department of Social Services. I think that if there's some question as to my recollection, that certainly the county attorney would remember that. After about a week, Mr. Button came to the conclusion that without authorization, he had no business performing that function. And he advised Mr. Haggard that he would no longer be able to do it. I give Mr. Haggard credit. He looked at his situation, and I'll explain what his situation was and is in a moment. But he took a look at that and made a decision that this type of intervention, if you will, by the county attorney's office in taking a sizable amount of legal work essentially out of the hands of the attorneys that at the time were there and doing it with the attorneys in the county attorney's office would be a solution that might work. Well, as we know, Mr. Button did stop working there and still has not worked there to that day, but still provides a considerable amount of legal work with respect to the Department of Social Services. Why did Mr. Haggard think of this idea in the first place? His lament to the Commissioner of Social Services that was relayed to me in a conversation that she and I had here a couple of weeks ago was that he didn't have, nor did his staff, his attorney staff, have the time to adequately prepare for the court appearances that they are daily required to attend in the courts of family court. In order to do that, he, I think, when he thought of this, thought that this might give him a little bit of additional time to perform that function. And having been to court many times in my life, I know how important it is to prepare for your courtroom appearances. It isn't something that you just walk in, spout off a few facts and leave. You better have your stuff together. That's part of the general counsel's job, is to see that that gets done. In order to further that job, he came up with the thought that the county attorney, as is done in half of the counties in New York State, could certainly provide some assistance in that matter. So the thought was, if we provided the staff that the general counsel needed and asked for through the Commissioner of Social Services, which we have, and if we were able to provide the services of 2 additional seasoned attorneys that do and have and done work in the family courts on behalf of social services, that it would free up his attorneys to be able to look at the cases that they had, interview the caseworkers, and prepare their cases in such a way as they had a professional product in family court when they had to go there. Those were the reasons behind that. There's nothing nefarious in this. Mr. Haggard had a very good idea, to his credit. It didn't last long because of the lack of participation by this board in allowing it to continue. And I think that that spawned this idea about how to help out the Department of Social Services that was at the time, through its general counsel, complaining to the commissioner that we don't have the time to do our job properly. Thank you.
Any other questions? More discussion? Yes, go ahead, Ms. Bianco.
Can we ask Cindy what she wants and what would best serve the department?
One more time with that question?
Can we ask Cindy what she wants and what would be best for the department?
Yes. Go ahead, feel free to ask her. Cindy, did you hear the question?
I did. So I've talked about the paralegal position and the student that we do have, the intern that had been working for us for several months from Syracuse University. He has taken his bar. He has not found out yet if he has passed or not. The hope was to bring him on as a paralegal. He also has his MSW, which would, bring him to be a huge asset to our department. He lives in Oswego. He's been driving here to work for free. He really likes the department. He would like to have a career here. So the thought would be that once he, found out that he passed his bar, should he pass his bar, hope he does, and that would probably be about February, that, and then maybe into February, March, he would be, get through his stamp of approval to be an attorney, and then he would become the perfect entry-level attorney to take over our supports. He would be able to do all the support cases and to support our staff, in Child Protective Services and Children's Services with his expertise in, with his master's in social work. So to ask what I want, that would be the best case scenario, is to bring him in and then, bring him in as that entry-level attorney into support with, it would cost us that much or more just for his master's in social work that we need just as much probably as we do an attorney for support cases. So I think when we were considering the contract out with the county attorney, a lot of the thought of having our intern, get through his passing of the bar, getting his stamp of approval from the Bar Association, to where he could actually practice, would run into that, 4 to 6 month period where we would then reevaluate the contract and take it back into the Department of Social Services, with that expectation of, this person who would currently be in our paralegal position taking over that entry level position and beginning his growth, growth through the department, hopefully maintaining it and maybe through attrition, rising up in a promotional way. If that answers your question.
Mr. Burke, or excuse me, Mr. Tony Artwood. Go ahead.
Thanks. I'm very forgettable, Mr. Chairman. I'm very forgettable. So from a county cost standpoint, I think if I'm not mistaken, we're looking at 17,000 for the individual Cindy just talked about. And then it looks to me like it's almost cost neutral then, because we're looking at 9,600 and another 5,400 for the county attorney's office, just from a cost perspective. Am I correct?
Yeah, I don't know that, but.
The resolution speaks to a $9,600 additional cost into the county attorney's office, along with the number 2 there, making 5,400. So we're right in and around the 17,000 that Cindy just described, if I'm not mistaken.
Is that our attorneys? Because I don't have that in my resolution. I don't know. I guess I don't know what you're referring to.
Yes. I'll look it up and get back.
Okay.
Mr. Akers.
Thank you, Mr. Chairman. Cindy, I can remember talking about this individual with the master's in social work and doing the bar. I don't remember any discussion about this individual doing support. What I do remember was a discussion about actually having this individual with his master's in social work and actually his legal degree is actually working on reducing the number of years that we had individuals in foster care and actually in the individuals that are institutionalized. I don't remember any discussion at all about having this individual working on support cases. There's certainly higher reimbursement if this from the state with this individual, or if there is a need for an individual. Right now, according to Mr. Button, we just made it need an additional legal secretary. And I believe it was, we received a letter, and I think it was, I don't have the exact date, a letter basically that went to Judge Morris that said the county attorney will be now doing the support cases, unannounced to the county attorney himself. This is a pretty straightforward resolution. It looks for putting this under the umbrella of the county attorney for a year. And I think that was an initial request from Mr. Haggard, and I think we need to act on it, and I would support this resolution. Let's like to move on.
Mr. Burke.
Well, I guess maybe a procedural question. Is it our authority to act on it, or is that authority rest with the Commissioner of Social Services? I believe we appointed her for a specific term to fulfill all the obligations of the office. So I guess I wonder if we have the authority to make a ruling on this, or if we don't. And one other question, just to ask: Are we proposing that the county attorney and his assistant work more than 35 hours a week, or are we still talking about the basic work week of 35 hours? Because as I look at some of the other departments that have lost key positions, I don't know, have we ever replaced Keith Zimmerman's position? I think, Kevin, you said we've gone from 1,100 down to 800, and the same amount of work is being done. That was your statement, Kevin. And I guess I guess I'm wondering, we didn't offer to pay those people any more money for doing more work. So I guess I'm wondering what this is all about. And again, to go back to the basic question, I believe this is Cindy's jurisdiction. I don't think it's ours.
To answer your question about whether you think that we have the jurisdiction, that would be, the county attorney just talked to great length, sounded like we do, without actually saying those words. Could we get the county attorney to weigh in on that part of your question?
It's fine with me.
Go ahead. What is your answer to Mr. Burke's concern on the whether we legally can do this?
Well, I think you're right that I didn't actually outright state it, but it all goes back to Social Services Law Section 66. Social Services Law Section 66 states that with the approval of the Board of Legislators, that the Department of Social Services Commissioner may fill as many appointed positions for attorneys, experts, and the like to perform legal functions if necessary. So that function was essentially divested from the county attorney's office actually back in 1984. Up until 1984, all of DSS legal matters from Article 10, neglect and abuse cases, Article 4, court cases, Article 8, family offenses, all of those cases ran through the county attorney's office. At that time, the board voted to create a full-time position and allow the DSS commissioner to fill that position. Effectively, what this would be doing would be revisiting that determination associated with certain functions for a temporary period to allow during that time period for the county attorney to perform those functions again if the board so decided that's what it wanted to do. Yes, the short answer is I do believe that the board has the legal authority to reinvest the county attorney with the power to carry out the support function.
Thank you. Any other questions? Okay, Ms. Haggard, go ahead.
Not a question, a comment. Since my favorite last name has been invoked several times during this discussion, I'm going to go ahead and recuse. Thank you.
Okay, noted. Okay, are we ready for a vote? Yes. All in favor?
Aye.
Opposed? Carried.
Aye.
Okay, let's move on to the St. Leonard County vacancy authorization business. Ruth, did you want to start out on that, or?
Sure. Briefly, there's only one department tonight for consideration of these from social services. So I will turn it over to Cindy to walk through the four requests we made. Cindy?
Okay, is there any particular order I need to go in, or can I just start?
Go start out with Bill Senior Social Welfare Examiner, TA and SNAP.
Okay, so the first one that we'll talk about is our social welfare examiner. This is a full-time position, permanent fill. This is a staff that was promoted. She is going to work as a support investigator. The net county cost is $20,316. So the examiners are responsible for interviewing clients applying for SNAP. They determine eligibility, compute certifications, maintain ongoing SNAP cases to meet state mandate deadlines for processing of the applications. They ensure clients receive all benefits that they are entitled to in a timely manner. Average examiner is responsible for interviewing and determining eligibility for up to 30 applicants per month and up to 500 transactions monthly. So each social welfare examiner serves approximately 937 people. So I'm asking for an immediate fill on this, if possible.
Okay. Okay, let's move on to the second one, Cindy.
Okay, so this,
Create and fill an account clerk at county.
so the abolish and create, so this one is requesting an account clerk position, and this is an abolish and create. This was a clerk position that is opened that we would like to bump to a account clerk. It's a little bit tricky of a position because it was actually a full-time clerk position, and then they had a half of an FT open for an account clerk, which they were sharing with daycare. So now the daycare is going under different supervision. So instead of having the full-time clerk and a half of an FTE for account clerk, we're just going to take away the clerk and move it to an account clerk position. So we're going to abolish and create this. It would be a full-time position. This person has retired. So the account clerk, get ahead of myself here. This position will assume the responsibilities of both positions. Responsibilities include weekly processing of the HEAP remittance, preparing of volunteer and client transportation reimbursements, processing and mailing landlord checks, mail runs and delivery duties, transportation of the deposits to our treasury office, prep and scanning of documents, filing and sorting accounts receivable, payable documentation, and prep work assistance to the senior and principal account clerks. So we're also asking for this position as an immediate fill. They are down a couple positions in this unit, so we would like to get this posted as soon as possible. This is a county cost of $10,480.
Okay.
Okay, so the next one is a senior account clerk. This is a permanent position, full-time. It was a promotion of a staff to a different department. This is the net cost to the county of $11,448. This position maintains the cash management system by posting impungements and recoupments, reviews claim reports, and communicates with caseworkers to resolve discrepancies, corrects errors, prepares a cancellation roll for voiding checks, which is used in the reconciliation of our EBT accounts, prepares up to 3,200 claims to identify and report SNAP errors, prepares weekly audits for accounts payable, and this position touches the benefits and services of more than 20,000 county residents. So we're also asking for this position to be an immediate fill, being that they are down a couple positions in that unit.
Any questions? Okay, Cindy?
Okay, then the last one we have tonight is our create and fill is our paralegal position for full-time. This is this position would cost the county, it's a new position, it would cost the county $13,746. Again, we had talked about the legal unit. This position would contribute to the legal unit immensely with helping them with their time of preparation for cases. Right now, it can take up to 3 days to prepare for a trial. So that takes the attorney out of this 3-day prep, puts the paralegal into probably at least 2 of them to get all the documents gathered and put together. The paralegal will provide expertise and assistance to help these attorneys to prepare for these cases. I've talked to quite a few commissioners who have these paralegals, and they say that they are a huge asset to their departments and save their counties or attorneys a lot of time in prepping and enable the attorneys to spend their time, you know, in more of a quality discussion with the caseworkers as they're prepping for the trials. So I'm also asking that this be, you know, brought up as an immediate fill.
Any questions on any of those 4 positions? Thank you, Cindy. Oh, wait a minute, I see, I think, Mr. Manelli. Got my long distance on now. Thank you.
You need stronger glasses, Mr. Chairman.
I like the motion. I can see the motion better than just a straight.
Okay, I'll make motion next time. I'm just wondering, it says it's a create and fill, but it has the salary of person leaving listed as $48,326. So I was just confused about that.
I think that's a base amount.
Okay.
Yes.
As you see, it's low down below. Yes, I think you can take that.
Okay, perfect.
Thank you, Ruth.
Sure.
Yes, thank you, Ruth.
You're up next, by the way, Ruth.
I am. Thank you, Cindy, very much.
All right, thank you.
County Administrative Report.
Good evening, everyone. I continue to get used to broadcasting to you this way, but I can see everybody, so that's helpful. I just want to reiterate a couple of points that were raised in the COVID conversation earlier this evening. Our work group efforts continue to step up. Frequency now, we opened the task force also looking to be helpful in any way possible with the efforts. Certainly that communication piece with businesses is helpful as far as what the state of emergency meant, as far as seeing these changes that happened on Friday, an executive order, and also going forward. I think a number of conversations will continue with that group. Any way they can be helpful, they're certainly prepared to do that. Met today and continuing to meet with the sheriff and the county attorney with specific discussions about enforcement, looking at any kinds of complaints coming in. Again, just to remind, I am on the school front and or the both communicating on immediate basis. When any of those complaints come in, I go right to the school district and have that dialogue as well. There have not been very many. I believe that we may be up to 6 since school began. So consider some of the comments that were made about how careful schools continue to be held true by the complaints being limited coming in as well. They always have plans to respond to them. They always are ready to address them and come in. Wanted to give you an update on the county map. They are in production now. Quite timely, we thought missing the back of the school, we were a little concerned, but we're more excited, I think, now to get those out, the numbers that were set. So we're going to work with both these those, and in a safe way, have the youth be able to either package the boxes to head out to the schools, or in some way have the youth committee participate in preparing those for distribution as well. We're very excited about that. Way with the 50% in office for our employees. We are also having folks who may be able to assist during work hours with the contact tracing, as Dana mentioned, and as well as HEAP. It is HEAP season, so keep in mind we certainly get a lot of contacts that way as well. So we want staff to be open to the idea that should there be some tasks they're able to complete in their available time, they can be on the phone answering calls for HEAP, answering calls for contact tracing, where we can get them trained, and to be helpful to lighten the load, we certainly will do that. I am excited to share, I think about a month ago, we shared with the board that due to the increase in cases, we weren't able to schedule our second flu vaccine clinic for employees. So we were trying to think about how we could effectively make that opportunity available. And we've partnered with Kinney Drugs, and they'll be sharing a pharmacist with us next Monday to provide the staffing that we need in order to provide the vaccine to our employees. So we'll be providing that on November 23rd from 12 to 2 at the Human Services Center. So I'm very excited that our partner, longstanding partnership with Kinney Drugs, has helped in this situation where we haven't had the horsepower to bring that back around. We had a great success with the drive-through clinic. We'll actually be doing this in one of the areas in the building. So we'll announce all of that and hope to get all of our vaccines to our employees as best we can. Wanted to give you an update. You approved a resolution a couple of months ago for renovations at DSS. The HEAP unit has relocated to the Human Services Center for a short period of time. We expect our office furniture to arrive tomorrow and our carpet to arrive next week. So things are, without exception, I'm hopeful, underway for getting those renovations complete, and then we'll continue moving on through the building. It is certainly one of the areas in our county facilities that is in need of attention. And we're happy to be able to start moving some of those things forward as well. Wanted to remind you that negotiations with our solid waste unit of CSEA will take place tomorrow and potentially Thursday this week. The group needs to be available here if you can at noon, but also available by Zoom if that's preferred. We will meet later this week with Ogdensburg to discuss the environmentally contaminated properties as well as the tax foreclosure process. So I expect that next week I'll be able to bring back some information to you about what that might look like. And then with regard to community services productivity, you did receive that update this evening, and I think that becoming a regular information piece to you is one of the biggest sense of progress I think that you can get relative to all the points that the board took great interest in as we moved through some of those changes in community services. And we meet with them periodically, the program directors and Jay, to go over those productivity levels, to talk about their improvement plans and really the sense of how their staff are doing and how we can be helpful to them. So that will be meeting later this week. And if you have any questions after you review that monthly report, or perhaps if you had some questions over the months looking at those, send those to us and we'll make sure we have those discussions and get clarification for you if it's needed. I did, just going back to COVID for one moment, we met last week, as Dana mentioned, with the Amish. We also met with the superintendents a couple of times, establishing that open communication, I think, with the unknown numbers we're heading into, seeing the weekend. Certainly, Tony, I think our office will try and assist where we can, getting those 7-day updates. I think that has come in quite a bit today. Having 2 weekends in a row of over 40 cases really is concerning. And then seeing some of those notices about where people have been. If we can do that, and if my office can be more helpful to get that information out there, we certainly will do that. Also want to let you know, if you haven't seen it, that the courts are modifying their activities as well. The protocol last week worked quite well. We did have a positive on the court's staff in this courthouse, and we were able to, within 4 hours, get our vendor here to do a deep clean without interrupting service and disinfect the areas and keep people safe and working. So that was, I think, a great example of our ability to react in these situations. We've been very fortunate to have only a few cases amongst our county staff, and our ability to respond really, I believe, is going to be the most important part of giving our employees the sense of security to be able to come to work when they're required to, but also that we're going to take care of the areas that we expect them to be and to provide services. So those are a couple of the other aspects of COVID I wanted to mention, as well as you're seeing some of the communication on transit, and some of our routes have been suspended and they may be impacting your districts. Certainly happy to verse you better in the impacts on your district if you would like. They're communicating, I think, very well when they have had a positive or an exposure. I think they've been one of our model organizations as far as reactions go, and happy to make sure that we can keep transit safely in place, but also modify and take a break from those routes when there may potentially be exposure. So those are areas that we have stepped up our conversations with transit as well throughout since we restored the College Connector and those routes continuing. We've talked with them every 2 weeks. We're now moving to talking with them once a week to make sure if there's anything that they need or anything that you need to be aware of, that we're doing that. And then just 3 more items I wanted to mention to you for finance for next week. In our budget discussions for the 2021 budget, we recommended utilizing fund balance for our next capital equipment purchase. So rather than look to add it to the levy or to finance through the issuance of a bond or some type of note, similar to what we did in 2016, at that time, using fund balance wasn't necessarily an option for us. But at this point, we'll look to the board to consider at finance an opportunity to utilize $2.5 million out of the road machinery fund balance. There is approximately $2.8 million available in that fund so that they can make that acquisition in the early portion of 2021 and move forward with their capital improvement plan for equipment. If you recall, we took that note in 16. We're recommending they utilize fund balance here in 21, and then they'll look again when the note from 16 is paid off in 26, they'll look again and we'll have a similar conversation, because to downtime with either equipment or maintenance of that equipment takes away from productivity. So those are some of the aspects, I think, looking long-term of how to improve the fleet, how to improve the timeline associated with projects. And I think that's also had a great impact on the year we've had in highway, will be very helpful. So Don will be here with you at Finance to talk about that. Mentioned last week to you that I met the new Historical Association Executive Director, Ashley Moretti. She will join us briefly next week by Zoom to talk with you a little bit about the technology advances that she's already proposing for the Historical Association. And if you recall, in the contingency budget for 2020, I set aside some funds. When we were asked to contribute to the endowment, my sense of the needs at the Historical Association more centered around their need for also some capital investment. So I set aside $12,500 in this year's budget, but with a number of changes in leadership there and administration, there hadn't been a plan put forward to utilize that. And as you'll recall, the Historical Association serves as our archivist for county records. So they'll be coming forward. They're working on the technology. They'd like to make archives digitally available as well as update their website. So she will be coming to you to talk about that and determine whether that's the right move for the investment for the Historical Association. Also next week, I will bring you a resolution to address the funds we set aside for Bassmaster this year and move those so that they'll be set aside if in fact we're able to look at holding a tournament like that in 2021 here, that those funds would be available without the resolution that we go through every year. That would be already there. So I'll bring that to you. And finally, next week also, I will bring you an update on the outstanding funds from the state. When I presented the budget on October 5th, if you recall, at that time, it was 11.8 million. So I'll do my best to bring you an update on that. Thank you. Are there any questions?
Looks like there are no questions, Ruth. Oh, wait a minute, Mr. Forsythe's got his hand up and he's waving it.
Ruth, just a question on highway, the 2.8 million fund balance. What about the outposts? We were gonna do a couple, 3 outposts. Where do they stand?
So the outpost project was delayed due to COVID. That is something that you will be seeing a conversation about in 2021. And in that case, the project would look to utilize some of the county road fund balance potentially, as well as potentially look to finance.
Okay, so go out to bond or something for it. Okay, all right, thank you.
Okay, any other questions? All right, let's move on to committee reports. Board of Health, Mr. Akers, do you have anything?
Well, what you heard tonight, and we'll actually be meeting tomorrow night also.
Okay, thank you, Mr. Akers. Mr. Lightfoot, CDB Board of Directors, do you have anything?
That board will meet Wednesday.
Okay, thank you, Mr. Lightfoot. Community Services Board, Mr. Akers.
Mr. Chairman, we talked about provider contracts, budgets, and appropriations. We talked about the OTB and the possibility that the building space that community services occupies in Messina now, if they went to telehealth and closed the satellite things, that could be available to St. Lawrence Health Systems also.
Thank you, Mr. Akers. Office for the Aging Advisory Board, Mr. Tedeschi.
Jim, we met on Monday, November 2nd, via Zoom. And some of the topics of discussion were the 2021 budget. We received a nice presentation on COVID-19 from the Public Health Department. And we also spoke about this is the time of year for senior holiday gift baskets. And the Office for the Aging tries to provide as many gift baskets as it can. So here I am again. I'm looking if you've got any spare change that you want to contribute to the senior holiday gift baskets, please contact Andrea Montgomery. If any financial support would be greatly appreciated. Our next meeting is going to be Monday, February 8th, 2021.
Thank you, Mr. Denisha. And Youth Advisory Board, Ms. Terminelli.
Thank you, sir. Some updates from the last youth committee meeting and the youth advisory board meeting. We saw tonight the OCFS monies are coming through. We originally had thought that it was going to be at a 20% reduction, and it was only at a 10% reduction. So the group was excited about that. The masks, Ruth had mentioned, the 16,000 masks are in, and they should be arriving on Friday. So working to distribute those through BOCES to the school districts on the week of November 30th, after the kiddos come back from the Thanksgiving holiday. There was an interest in seeing some of the other masks that were in the contest. That people really wanted to get their hands on some goods with the masks on them. So we're talking about opening an online store. It would offer some of the top designs that went through the process, and people would be able to purchase face masks, mugs, bags, different things using the top 3 designs. And then the proceeds would go to benefit the North Country Art Teachers Association. We have a Secretary 1 position that will be starting soon. Our next youth committee meeting is Wednesday at 4 p.m. We're hoping to talk about some holiday cards. So maybe Mr. Denisha, we could accompany those Office for the Aging baskets with some holiday cards made by our youth committee. Hoping to get some videos out to some virtual workshops and some vision board stuff for the county's youth. And then I just want to give a shout out to, in October, Cole Siebels and Amanda Woods, which are 2 of our youth committee members, actually interviewed Tom Nichols and Jenny Bacon with the Board of Elections about the election process, and just some questions and concerns, and just to get information, really to be more educated about the whole how youth could be involved in the election process, being that they're underage and not able to vote. And Mr. Siebels this past week was able to take, it was a pretty long interview, and he was able to take it and edit it into a nice video that they put out on the Youth Bureau's Facebook page, and hopefully it'll be up on our website as well, the county website, soon. So I just want to give a shout out to them for their interview and being involved in the process, and then editing that video to get it out for people's pleasure and viewing. And I think that that's it. My next meeting is December 3rd at 3 p.m.
Thank you very much, Mr. O'Malley.
Thank you.
Is there any old or new business that we have to talk about here tonight? There being none?
Yes, Mrs. Haggard.
Oh, there you are. You're waving. I see it. Go ahead. Go ahead, Ms. Haggard. What's the new business? Or old?
That was kind of scary.
Go ahead.
Did Mr. Akers say that was scary?
I didn't hear him.
Yes, I did. When you went like this with your Halloween thing, like that's
Okay.
I had a flashback.
That was my whole purpose. Okay. And am I correct in assuming that any legislator can attend any one of these committees?
Yes.
Yeah.
And how do we find out, like, for example, the Board of Health is tomorrow they meet. Is that online or is that in person?
I can answer that.
Go ahead, Mr. Akers.
So it will be on Zoom, but I must tell you that since March, pretty much we moved right into executive session, and that for discussion of those issues. So it's not that you are not welcome. It just may be a very short, brief interlude before we go into executive session.
Thank you very much.
Any other questions or comments? I don't see any. Okay, Ruth, do we have a need to go into executive session? And if so, what do we need to go into executive session?
We do for negotiations and personnel.
All right. Is there a motion to go into executive session? Mr. Fay makes a motion, seconded by Larry Denisha. All in favor?
All right.